Raised your hand when you said you know, or you also live with somebody who has a disability. And I think that that's really important because I represent the littles who, when you come into this world and you bring this beautiful baby home, and that baby may not be meeting those milestones as you really anticipated. And so then what do you do? I don't work in Waukesha County. I really work a lot more in birth to 3 in Milwaukee County. However, a lot of the programs are similar to how they serve people. When you get that baby, you call, and you can call the Birth to 3 program, and that's an early intervention program that works with kids to keep them on track, helps them meet their developmental milestones, and works with the family wherever they're at in their lifespan or what they need. They provide services like physical therapy, occupational therapy, speech therapy, vision services if your child has a visual impairment, or hearing services if your child is deaf and hard of hearing. In addition to that, they also supply all the things that the family needs to help navigate the system of ins and outs in school and helping transition. What I wanted to talk about is the Birth to 3 program is funded in many different ways. In Waukesha County, and each county is really different in the way that they use the funds, but specifically for Waukesha, they use government funds, they use Medicaid, private insurance, and sometimes parental cost shares if parents can afford to pay into their services. One of the things that is available to families is children's long-term support. And this is for children with disabilities. They have to do a functional screen to be eligible. And the functional screen will also tell them if they would qualify for Medicaid or Medicare services for the child. So when they receive the CLTS funding, they may have to pay again a portion of the costs, but the insurance is that forward health card that gets them some additional services. Some families just use that insurance, other families use their own insurance, and this is kind of a backup. The Medicaid is a backup, which is really helpful for them. A lot of times a child needing a wheelchair may need a stroller out in the community, and so Children's Long-Term Support will pay for that stroller if this is what the family needs as a goal to get the child out of the community. The program is really intended to help families stay in the community with others and not to put a child in an institution, and so that's really important to us because we all know when we get into those institutions what happens. There also are other programs called Children's Community Options Program, or CCOP. And in Waukesha County, that program pays for other things that the family may need, which might be larger ticket items, to help a family, get a fence because the child is running away, to keep the child safe, to maybe do a bathroom remodel if a child is in a wheelchair or a Hoyer lift, things like that family may need. Children who are eligible for the CCOP program do not need to have a disability determination or being currently enrolled in Medicaid, but they must meet that functional level of care. So there are some children who may fall through the cracks in that way. Children who are enrolled in CLTS automatically are enrolled in CCOP. We also have the youth services are really operating on a fee-for-service model. So during that intake process with the person that you call in the county, the fees will be discussed, and everything, the delivery of services will be also determined and talked about with the family. Another program which is completely Medicaid funded is Comprehensive Community Services for Youth. We also have those for adults in mental health. And currently that's where I work in Milwaukee County with the youth in the CCS program, which again is Comprehensive Community Services. It also helps with substance abuse conditions. So people who are unable to, maintain their own lifestyle because of alcohol or drug abuse. Youth who have serious mental health issues get a lot of support and kind of wrap around and support that child and that family through whatever services that child may need. Without the funding from Medicaid, what would happen is that medical funding for children with substantial limitations due to an intellectual, developmental, physical, or mental health disabilities would not receive services. A reduction in medical or Medicaid could decrease the funds available for the program, leading to fewer children being able to access it. We do know that there is or was a wait list for children in Waukesha County for children's long-term support. And so can you imagine how long that wait list may be, or children who are falling through the cracks and not getting services, or aren't ready for school when their peers are, or families who don't know how to navigate the system. It can increase the financial burden on families. So families who may not have that backup insurance, like the Medicaid or Forward Health or whatever insurance that they pick up because of their child's disability, their co-pays are extremely high. Parents can't work. parents have to afford to, be a caregiver for their child. They're not accessing their insurance, or their insurance copays are too high that don't cover everything they need, or that child doesn't get what they need to be out in the community. The impact on the Birth to 3 program. So because it's funded in several different ways, might be a little bit different for each county. However, they may have limitations on services they provide. So if a child gets physical therapy, occupational therapy, speech therapy, those are all services covered under Medicaid. And so those children may not get the services, or they may be reduced. Some of the unintended impacts of Birth to 3. So if a child is graduating and does get the services they need, they come into the school district, and then they have, they need additional services once they get there, or outpatient services, or maybe they can't even afford outpatient services as well. There's also strains on other services, like I talked about the community, comprehensive community services for youth, that is fully funded through Medicaid. And so people with mental health issues or mental health concerns, again, are not receiving services, which may lead to institutionalization. It may lead to more homelessness or more drug abuse, and other things that with our community. We also have an increased reliance on fee-for-services. So families have maybe a small copay. However, if we don't have the Medicaid services, they may be asked to pay more. And again, if you're not working because you have a child with disability, that's going to be an additional burden on that family. So I'm here because I want to make sure that our Medicaid funding is not cut. I want to make sure that we don't have these negative effects on our families. I feel like I'm fortunate in my life to be able to help my own son and understand the services and things that he needs, but there are plenty of families who don't. And even in our Waukesha community, we have a lot of families who aren't able to access services in the way that they need to, or even know about these services. So it's critical that we make sure that they are supported in the ways that they need to be. I want to talk also about the youth services guide that I brought here today. I have it on my chair over there, but I'll put it out for you to look at. But it does provide, it talks about all the services that are provided for children in Waukesha County. And so if you have questions or you want to take a look at it, you can get it there. It's also on the website if you want to. I also want to welcome Ryan Tatt, who's joining us from the Waukesha School District.